Hi everyone, I'm Kelly Rose. I'm one of the 3 estheticians here at Weston Plastic Surgery. And today we're going to talk about melasma because July is Melasma Awareness Month. Melasma is a skin condition that's characterized by brown patches or brown spots. It normally happens on the face, and a lot of times you'll see it on the cheek area, the upper lip, or the forehead. It kind of happens more in patches than a freckle-like appearance. It's normally brought on by hormones, UV, heat, light, and all of those things. It affects women more than men. About 90% of people affected are women and 10% affected are men. And we think that's because of that hormonal aspect that's coming along with it. It's often commonly referred to as the pregnancy mass. So if you ever hear someone talk about that, they're referring to melasma. And it's called that because of that hormonal flare-up that you're having during pregnancy. A lot of time for women after the pregnancy, the melasma will tend to fade. And so we really recommend while your melasma is coming up that you wear a lot of SPF, stay out of the sun, wear hats, really try to protect your skin during that time. It can also happen when you're using hormonal contraceptives. Unfortunately for me, I have melasma. We've covered it up with some makeup today, but it's something I suffer from because I do take a contraceptive that has made it flare up. It could possibly go away if I stop taking that hormone, but a lot of times we're trying to control it now with products at home and treatments in-house. So the gist of how that happens is the epidermis contains melanocytes, and the melanocytes produce your melanin. And when they become overreactive, you have an overproduction of that melanin in your skin. Again, caused by a lot of times that hormonal action in your body that then the UV light kind of flares up or heat flares up. So if you're considering treating this in-house, coming in and getting treatments done, we, for melasma, specifically recommend doing peels. For other forms of hyperpigmentation, such as freckles, we can do lasers, we can do IPL, but melasma in general, sometimes heat can cause it to flare up more. So I like to treat my patients with chemical peels. We have a few on hand, and let me just run you through those. The first one, and one of our lighter ones, is the Vitalized Peel by Skin Medica. Personally love this one, and normally start a lot of patients on this one to see how they tolerate it. Another one that we have is called the VI Peel. This one is specifically called the VI Precision Plus because this one was made for hyperpigmentation. So it's gonna get in there a little bit deeper for people who have hyperpigmentation. And the last one is the Mini Melanin-rich Peel. What I love about this one is it comes with a custom cream that we mix for you that you will continue to use after that peel for about 2 months to really get in there and affect those melanin happening deeper within the skin. What's great about all 3 of these products that I went over are they are safe for every Fitzpatrick. And when I say that, I mean they're safe for every skin tone. And last but not least, we want you to go home and make sure you're using some kind of melanin inhibitor. Basically, we want that melanin to kind of be at its lowest production point, and there are 3 products I specifically like. I touched on this one. This is the custom cream that comes with the Mini Melanin-rich Peel. You can use this one up and then have us continue to make this product for you. We mix in arbutin and retinol in this product, and it can be specific to the time of year. I can add a little less retinol or a little bit more depending upon if it's summer or winter time. Love this one. One of my favorites is the Even Tone Correcting Serum by Skin Better. Just brightens your skin. It's one that I feel like after you've done a heavy peel, after you've really got to the results that you're kind of looking for, that you continue on this path to really help the skin not overproduce that melanin. And last but not least, this one can be sometimes slightly controversial because it has a 4% hydroquinone, but I do like this one to sometimes jumpstart patients who really have stubborn melasma. The main thing that I tell people is you need 3 months on it and then 3 months off. When you're using a hydroquinone, you don't want to be using it long term. This is the vitamin C with 4% hydroquinone by Obagi. I hope you found this information to be helpful. If you have any questions or concerns or want to make an appointment so we can talk about these things and really start to hone in on what's going to work best for you, go ahead and call the office and set up an appointment. Once again, I'm Kelly Rose, one of the 3 estheticians here at Weston Plastic Surgery.